Good morning. My name is Dr. Raja Adnan Ahmed, and I am a consultant psychiatrist working in UK. And with me this morning is Dr. Amit Kumar Chougule, and Amit is a MD from India who came to UK in 2019 on the MTI scheme. And the reason I requested him for this interview was that I wanted to someone who has gone through the MTI scheme to share their experience of how they felt as an MTI, and what they learned. So first of all, Amit, thank you very much for joining me and giving me the time.
Thank you very much. I think we were planning this since a long time, but finally we are doing it. I'm really happy to be here today and share my experience.
So Amit, the first thing people will ask that what exactly is an MTI scheme, because it can get confusing for IMGs to sort of look at different routes.
Yeah, so basically MTI is like a fellowship scheme of 2 years. So what happens is if the like in MTI scheme, people are expected to work as a CT3 level, which is like a core trainee 3 level in the UK. So if during the recruitment process in the UK, if some CT3 posts are vacant, then those go to MTI, and the international medical graduates which apply to this scheme, they are matched to those posts and they get the fellowship. So basically they come on, like they get all the training which is very similar to what a UK trainee at a CT3 level gets. So yeah, it's a brilliant scheme, I will say.
And with MTI, you get a visa for 2 years, and I think it's as a tier 5 visa, which is different from a tier 2, which a normal trainee gets.
Yes. So basically, the whole idea of MTI is like it's a 2 years post where uh, a IMG from a developing country gets a chance to see how the psychiatry works in developed country, so that they can learn here and go back and apply that to what I mean in their own country, basically.
So Amit, you came in 2019, and you were working in Wales. How has your experience been as an MTI?
Yeah, I think I mean brilliant. I mean, basically, I will say that the application process for me was quite frustrating. I think because of Brexit, there were a lot of problems with documentation. But I'm happy that finally I came and I started in Wales. The best thing about Wales was the support. I mean, all the consultants here are very supportive. Uh, I started in around April 2019, and I'm about to finish my MTS scheme. So, in last 2 years, I mean, I have like done 4 rotations now. So, I mean, it has been a very good experience, I will say.
So this is important to notice that that the MTI fellows, so they normally would rotate in between the jobs. So rather than staying on one post, they will be sort of going every 6 months to a different post. I think most of the time it will work like that. Is that right?
I think few of my friends, I mean, it all depends on you basically. That's the beauty of this scheme. Like, if someone wants to be in a subspecialty of their choice, they can stay on that for like 2 years. I know few of MTI trainees who have done 2 years completely in child psychiatry because that's what they wanted, and that's they will get that. But I personally wanted to rotate because I wanted to get experience in all the different subspecialties, which I didn't get a chance in India. So I did old age psychiatry for a few months. Then I did rehab psychiatry. Then I went to camps, and now currently I'm in liaison psychiatry. So I'm very happy because I got experience in all different subspecialties.
And did you get help from your supervisors? Did you have assigned supervisor and sort of help in that way?
Yeah, definitely. I mean, this is the important part of MTI. It's a training post. So you get everything what a UK training gets. So you get an educational supervisor, you have a training program director, and you also have a clinical supervisor. So I had like, yeah, our trust. As soon as I started, I was allotted an educational supervisor and then clinical supervisor. Every 6 months, they keep changing. Yeah.
And a lot of MTI trainees will also look at the MRC Psych exams as well. They'll think if we are already in UK, maybe this is the time for us to pass the MRC Psych. Um, how did you find that? Did you find support in that and help in when you were doing your MRC Psych?
Yeah, definitely. I mean, a lot of people ask me that. I mean, there is some misconception that if you are planning for MTI, don't do MRC Psych or something like that. But I will advise all the trainees that if you are planning for MTI, you can do MRC Psych while you are in your own country. But once you come here in the UK, MTI is the best time to clear your MRC Psych. I got brilliant support. I mean, I got special sessions like educational session, which core trainees here get for MRC Psych. all the leaves for MRC Psych, yeah, before the exams, everything basically. So the support was brilliant, and I cleared my MRC Psych last December finally with
That's
all
good.
the yeah.
I think it's also important to sort of see that you also can get some peer support as well. So, because some people like to study in groups or sort of get help from their peers. So if you are already in UK and on MTI scheme, do you think it's a better opportunity for somebody who's doing an MRC Psych exam to avail that as well?
Yeah, definitely. I mean, I advise everyone that you can do your theory exams like paper A and B while you're in your own country. But for CASC, it's better to come in the UK or the MTS scheme and then do the CASC, because it will definitely help you in passing CASC. In our trust, it was brilliant, as you know, that we had amazing peer support. A lot of our higher trainees and our consultants, they helped us during the CASC exam. I personally did not attend any other mock, no classes, nothing, but I could clear my CASC in first attempt, all because of, I mean, the training which we had. So yeah, the peer support was excellent.
Okay. So we are recording this interview on 21st of February 2021, and then next MTI scheme is already on advert by the Royal College of Psychiatrists, and I believe their last date is 8th of March. So
Yes.
people are must be already filling the applications. Um, so I just wanted to ask you, how should if somebody is sitting in their home country, a psychiatrist sitting in their home country, thinking about coming to UK via the MTI scheme, what should they be doing right now, or if they're thinking about coming next year, what should be they doing to sort of improve their chances?
Yeah, I think that's the most important question, I will say, because in MTI the most important thing is plan. I mean, I'll say plan like multiple times, because if you're planning for 2022, you need to start right now. There are a lot of things you need to do. Most important thing is documents. So even if you're planning for next year, I will say that everyone should go through the Royal College website for MTI this year. They should see all the documents which are needed and start preparing for that. The most important ones are like getting like a membership of their National Psychiatric Association. So for if they're in India, they should get a Indian Psychiatric Society membership. Then another thing is ECFMG verification. They should start thinking of English exams like IELTS or OET, because the problem is the applications open in November and they close in March. So there's a very short window, and in that window, if they are not able to get even a single document, then they cannot apply for that year, and they just lose 1 year. So I will say documentation is the most important part. They should start doing it right now. Like,
I think it's important to mention the English exam, as you mentioned. If you are planning for that, rather than waiting for the application to open, it's better to get that English competency, which could be IELTS or OET exam, out of the way, because that will at least be less stress for you. Um, and then you also mentioned that I believe the MTIs, you need to have at least 3 years of experience in your home country to apply for MTI. So you don't need to have done MD, or if you're coming from Pakistan, you don't have to complete your FCPS or any higher qualification to apply for MTI, but you just have to have the experience of that level behind you. Is that right thing to say?
yeah. So what RC Psych says is like the person should have finished 3 years. They should be a trainee or working towards their MD. So it doesn't require that they should have a MD. So even like in the last year of their MD or last year of their FCPS, they can apply. And by the time they reach UK, they would have finished their MD. So there's no need to wait for the MD to finish.
Okay. And you mentioned the importance of documentation, which is very important, because I think maybe in our home countries we are not collecting that many documents. But to actually also to improve your application, is there anything else they should be doing their training? If they got a year, if they, for example, expecting to apply next year, is there anything else they should be doing?
Yeah, I think I will advise everyone that MTI is also getting very competitive year by year, because I think last 2 years we had around 99% fill rate. So there will be very few seats which will now come to MTI. So everyone should get their CVs very nicely. So thing is, they should do things like research, any publication, then an audit will be good. Like any presentation in national or international conferences. So now RCPsych conference is coming in June, so they can present something there. So they should start working on their CV right now, so that they will be prepared by next March when they will have the interview.
Okay. And I think it's important to as you mentioned in the past, attending conferences were about going to a different country and all that. Nowadays, because the conferences are happening online, it's much easier for people to do their poster presentations or even present in those conferences while they're actually in their home countries, which is a big advantage. And
Yeah, absolutely.
Also a lot of other a lot of trainees, junior trainees, they contact me around. They do a lot of they teach a lot, but they don't have any evidence behind to back that they have been doing those that I think so. It is also important to gather to understand what kind of evidence is required if you are working on a post where you do a lot of educational activities.
Yeah, I think documentation and evidence is something which we don't do in while our training in India. So I will advise everyone that if they are doing anything like say a psychotherapy or teaching, they should get it signed by their whatever the head of department or their supervisor there and there itself, and they should prepare an evidence which can be presented next year. So I think there are few pro formas available on GMC website for uh, for the teaching they do, so they can use those or whatever. Yeah.
Okay. Um, so Amit, what are the things that an international doctor should know or be aware of when they're applying for an MTI scheme?
Yeah, I think this is a very important question because I see a lot of people coming to MTI, like they are quite senior doctors and they join MTI and suddenly they notice that they are working like a junior doctors and it's quite frustrating. So I would like to tell everyone that MTI is a CT3 level post, which is a core training post. And when you start, you will start as a junior doctor. So you will have to do all the jobs which a junior doctor does, like something like blood collection on the wards, doing some odd like ward jobs. But I think that that's fair because you cannot expect, even if like I have say 10 years experience in India, that doesn't mean I can start like a senior doctor in the UK because the system is totally different. And I will advise everyone that when you come to the UK, at least minimum 6 months, and I think 1 year should be good, but minimum 6 months they should work as a junior doctor. This will help them to understand the system. This will help them, like when they become a senior doctor, they will know what exactly happens, so that they can guide the junior doctors that time. So that this is something they should know. But said that, once you finish your 6 months or 1 year, the way you perform, and if you get your something called a Section 12 approval,
Hmm.
you can become a senior doctor or middle grade doctor even while on MTI. So I am currently a middle grade doctor. I do second on calls, so that can be done. But when they start, they will start as a junior doctor.
Okay, thank you. I think that was an important point to mention.
Yeah.
So, Amit, thank you very much for such a good advice on different aspects. Is there anything else that they should be considering, the IMGs or international medical graduates, when they are considering MTI?
Yeah, I think another important aspect is finances. I mean, till you start the process and you finish the process and till you reach UK and till you get your first salary in NHS, it's quite a, I'll say a bit of expensive process for, because if, in the developing country, based on the salary you get, it's quite, I will say, quite a expensive process. So you need to think about your finances. You start planning for right now. So I will say, till you get your first salary, the cost can be around 4 to 5 lakhs in Indian rupees. So something similar to that. So everyone should start planning about that. A lot of trusts, they provide something like a relocation package and everything gets covered, but initially you have to pay. So they should start planning about that also right now. Yeah.
Uh, Thank you very much, Amit, for this session and the advice. I think, as I mentioned, the current MT application is on, and people will be shortlisted soon, and they will be invited for interviews. And then people will start asking us, how to actually go about the interview and what was the experience. So I think that will require a separate session when we can talk about the common interview questions and that has been asked in the past, and from your experience as well, that how to tackle that interview session for MTI.
Yeah, definitely. I think last year, as I think you must remember, we got all the questions, and in my book I have given like enlisted all the questions. So I think what we can do is, once they get shortlisted, we can have another session where people who have already cleared MTI, we can come together and we can advise them and do something like a mock interviews or something that will be helpful for them. Yeah.
No, thank you very much. And I would like to say that Amit has also already written some blogs about his MTI experience of securing, and he's also written a really good guide for MTIs who sort of from start to the beginning to the end, and sort of what sort of things they should be doing. So I will share the links with this video whenever I am sharing it. So I've got them all on my blog, and that will be shared with this video. Thank you, Amit,
Yeah.
again for your time.
Thank you very much. Thank you.